Okay, so from last class we were talking about antithyroid drugs, and in last class we talked that the antithyroid drugs are the drugs which reduce the thyroid gland activity and hormonal effect, and these drugs are used in hyperthyroidism or thyrotoxicosis. Generally, it includes Graves' disease, which is an autoimmune disorder. Today, we will be discussing in detail about this Graves' disease and toxic nodular goiter also. Okay, so and we classified and we said these three propyl thiouracil, carbimazole, and methimazole. These are very commonly used drugs, and actually they decrease, inhibit the hormonal synthesis. So that is why it is typical antithyroid drugs. Similarly, we have iron trapping inhibitor, but these are not used because of its side effects. And hormonal release inhibitor is there, but because the action in last class we talked, isn't it? The action of these is not very reliable, and when you give immediately, it will cause stop the release of thyroid hormone. But if you continue after 10-15 days, there will be excessive release of the hormones. Okay, so in case of hyperthyroidism, it is since we have better alternative, so this is not very commonly used one. And then we have a drug which destroy the thyroid tissue, and this is radioactive iodine. Out of this, the radioactive iodine 131 is used, which has the half-life of 8 days. That is what we said, and the other drugs are also used. So, and similarly, we talked about the thioamide, okay, and this is antithyroid drug, and it inhibit the synthesis, okay. So, by inhibiting the peroxidase enzyme. But what happens when you take the drug, it will start inhibiting the synthesis of the thyroid hormone, but it doesn't affect the hormone which has already been prepared or synthesized, which is stored in the follicle, that they are not affected. So that is why to see the effect of these drugs, you have to wait for some time. Okay, like 1 to 3 weeks, it takes 1 to 3 weeks time to show its action, and that period is said to be a lag period. So it has a lag period. Immediately today, if you start the therapy, okay, by today only or by tomorrow you won't get the effect, okay, because the effect, the hormone which has already been prepared, it doesn't have any action. So last class we talked about that. And propyl thiouracil has an additional mechanism of action that inhibits T4 to T3 conversion. Carbimazole, we said it is a product which convert to methimazole, okay. So pharmacokinetics also, last time we discussed an adverse drug reaction. Adverse drug reaction, there are adverse drug, these all adverse drug reaction. In adverse drug reaction, what we said important was, one is agranulocytosis, which is the rare side effect, okay, and but it is very serious, so that is why you have to be cautious. And if the patient complains of sore throat, whom you have prescribed the antithyroid drug, you have to be very cautious. And propyl thiouracil has a tendency to cause hepatitis or liver damage, so that is why it is not very preferred for hyperthyroidism, but it is drug of choice in case of pregnant lady, especially in first trimester, and the lactating mother. So in last class only we discussed about these. We compared between the propyl thiouracil and carbimazole. So carbimazole, even though it has less plasma protein bound, but its action is longer. The T half is long, okay. So this T half is longer, even though the plasma protein binding is less with carbimazole, that is something exceptional. And since propylthiouracil is less excreted in milk, it is good or a preferred drug in lactating mother, and it crosses the placenta less. So that is the reason. And it has additional properties, so that this difference also we talked in last class, and we talked about the uses of antithyroid drugs, and in case of thyrotoxicosis it is used and to make the patient euthyroid before thyroidectomy, okay, surgery, we use this drug. And even when you are using radioactive iodine to destroy the thyroid cells, then also you have to use this drug till say a few months, like 2-3 months, because this radioactive iodine shows effect after the maximum effect is shown after 3 months. So that is why this antithyroid drug is given, okay, before the action of radioactive iodine is seen. So ionic in this ionic inhibitor, we said it is a toxic. And iodine and iodides, we discussed. Lugol's iodine, it is used in hyperthyroidism in low dose. We can even use for prophylaxis of endemic goiter because it is a source of iodine, okay. So that is, and adverse drug reaction also we discussed. And I think we also covered this slide, isn't it? We started with radioactive iodine, and we said that radioactive iodine 131 is used for therapeutic value, while 125 and 123 is used for diagnosis. Okay, so how does this radioactive iodine work? Is it is taken orally. Last time in yesterday's class I talked about that. It is taken orally, and then orally it is absorbed, but it is concentrated, okay, in the thyroid gland. The cells will take it by sodium iodine symport, okay, that carrier protein. And once it goes over there, then it is started emitting the rays, gamma rays and beta particle. So gamma rays doesn't affect anything. This beta particle will destroy the cell. And how much cell it is destroyed? 0.5 to 2 mm, okay, of that area or distance it kills, okay. It has cytotoxic action. So um, and don't confuse, it is given by orally, and the dose is calculated in millicurie, okay. So in yesterday's class we talked about that. If you have any doubt you can ask, otherwise I will proceed from here for today's class. Anyone who is having doubt? Yes? Do you have doubt or no? Yes or no?
Excuse me, sir.
Do you have doubt in this portion?
Sir,
You want to ask something?
yes, sir. Sir, how does thyroid peroxidase antibody test is used to detect thyroid in a patient? Sir, anti-TPO test.
Sorry?
Sir, how does anti-TPO test, that is, sir,
Anti.
anti-thyroid peroxidase, sorry, thyroid peroxidase antibody test is used, sir, to detect thyroidism?
Now antibody detection, this, that. I think it is a diagnostic thing, and biochemistry can answer more. In pharmacology, we will be more concentrating on a drug, its action. Okay.
Yes, sir.
So that question will be more suitable for the biochemistry or pathology. Okay. So do you have any question what we have discussed till now regarding
No,
the medicine, its action?
no, sir.
Okay, then I will proceed. So uses of radioactive iodine. So radioactive iodine is used in hyperthyroidism, in Graves' disease and toxic nodular goiter. Okay, and generally response occur after 2 weeks. Okay, and the maximum effect or its action is seen only after 3 months. So you have to wait for 3 months to see its maximum action. And if that action is sufficient, well and good. If it is not sufficient, then you may have to repeat the drug. Okay. Generally, you will calculate the how much you want to destroy. So accordingly, you will give the dose. Okay, and that dose will kill the cell. If that killing or cytotoxic action is sufficient, well and good. If it is not, you want to kill extra more cells, then again you have to repeat the therapy. But therapy will be repeated only after 3 months. Okay, because 3 months you have to give to see the maximum action. Okay. And this radioactive iodine is not suitable for young, especially less than 21 years of age, because it may develop hypothyroidism in later life. Okay, so in young, we don't prefer this, the killing of the thyroid cells. Okay, and relapse case of hyperthyroidism after surgery or thioamide therapy, like you if this radioactive iodine is also used when you have done the surgery to remove some portion of the thyroid gland, but that removal, the portion which has been removed is not sufficient. The leftover part is producing more thyroid hormone, okay, and causing hyperthyroidism. In that case, you can use it. So relapses case of hyperthyroidism in that case, or thiamide therapy. Thiamide means with carbimazole, methimazole. Okay, so if there is relapses, then it could be used. And carcinoma of thyroid gland, also it could be used. Okay, basically this radioactive iodine therapy is alternate to surgery. Okay, now what are the advantages of this radioactive iodine is it is easy for administration. Orally it is given, effective and low expense. A low expense in the sense that if you compare with the surgery, okay, here it is taken orally, no need of admission and other thing, isn't it? So, and no risk of surgery or scar. So after surgery, there might be the scar, isn't it, which is visible, so that won't be there. And there is no risk of surgery. In surgery, okay, there are various risks, including like the nerve may be cut, and that lead to say change in voice, and especially that is very particularly important if the profession of the patient is singing or singing. Basically teaching, maybe little change in voice doesn't affect much, but singing it has a lot, isn't it? So disadvantages is it may cause hypothyroidism, and that hypothyroidism is irreversible. You cannot reverse that. Then again, you have to put the patient on thyroxine, levothyroxine therapy. So long latent period. I have already said you have to wait for 3 months to see the effect, and it is contraindicated in pregnant woman and lactating mother, and it is not suitable for young. Okay, I have already said, because there will be a chance of hypothyroidism for lifelong, so that is why it is. Fear of radiation induced genetic damage. Okay, even though it has not been proven that this radioactive iodines causes radioactive iodine causes the genetic damage or mutation of a gene, but there is a fear, unproven. Okay, so that is why it is a fear of radiation induced genetic damage. Okay, beta receptor blockers, the other group, okay, that is beta blocker, like propranolol, metoprolol, atenolol. So remember, we can use both these all, metoprolol, atenolol, but we prefer propranolol out of the beta blockers. We prefer, if there is no contraindication, if the patient is say not asthmatic patient and other, if you have to prefer the beta blocker, then propranolol is preferred. Okay, it is an effective adjuvant. It is not used as a main drug, but as a supplement. Okay, and these beta blocker, what they do, let us see. It gives symptomatic relief. Like I have already said, if you are using like say radioactive iodine, you have to wait for 3 months, and if you are using like carbimazole, methimazole, etc., you have to wait for 3 weeks. Okay, that means the patient will get the symptomatic relief of this hyperthyroidism in 3 weeks. And if the symptoms are very severe, then what to do? At that time, you will give this beta blocker. Now, this beta blocker will relieve the symptoms. What symptoms of hyperthyroidism? Palpitation, tremor. Tremor is especially suppressed by the propranolol, the non-selective beta blocker. Nervousness, sweating, myopathy, okay, without altering hormonal level. So remember, this beta blocker, they don't change the hormonal level. Hormone level will be there, but just by blocking it, the symptoms of hyperthyroidism will be corrected, or it will be masked. So the patient will not have a symptoms of hyperthyroidism. Okay, so that is quick symptomatic relief. Okay, it started today. From today only, you will the patient will observe the symptoms of hyperthyroidism has been reduced. Okay, propranolol, it is widely used. I have already said propranolol is preferred. Now, why it is preferred? And propranolol in hyperthyroidism, the dose of propranolol is high, like 160 milligram per day. Okay, and even it could be increased to up to, I think, 320 milligram per day. That is the 320 milligram, up to that we can give. Okay, so in high dose compared to for the cardiovascular problem, it is given, and it gives the symptomatic relief. Apart from that, okay, it also inhibit peripheral conversion of T4 to T3. So that is why the propranolol is preferred. Number one is propranolol can suppress the tremor also, okay, which the metoprolol or etinolol doesn't do that. Number one reason. Number two reason, propranolol also inhibit the peripheral conversion of T4 to T3. Okay, and active compound is T3, isn't it? So that is why the level of T3 will reduce. Okay, so these two things makes propranolol to be preferred over other beta blockers. Got it?
Yes,
Roll,
sir.
Yes.
roll number 93. Roll number 93.
Yes, sir.
Yes. Okay, so why propranolol is preferred over other beta blockers?
Sir, it will decrease the peripheral symptoms of hyperthyroidism, and it will inhibit the conversion of T4 to T3, which is responsible for the T3 is more responsible for the actions of the it is more responsible for the actions.
Okay, anything about tremor? Now see, symptoms are relieved by other beta blocker also. Why you are preferring propranolol? Because it is non-selective. It also minimize the tremor, and of course inhibit the peripheral conversion of T4 to T3. So this is very, very important point. Okay. Now uses, what are the uses of beta blocker? We can use it in thyrotoxic crisis, when there is crisis or severe release of hyperthyroidism or severe case of hyperthyroidism. In that case, you can use while awaiting response to carbimazole, you will be giving carbimazole in that case, or you can give radioactive iodine, but radioactive iodine are not preferred in this crisis. Carbimazole or even this beta blocker could be given for the patient who is waiting for the surgery, okay, for symptomatic relief. Just these beta blockers, they are generally used for relief of the symptoms of hyperthyroidism, especially the cardiovascular symptoms, okay. Now let us talk about Graves' disease. This is also this is an autoimmune disorder, and here antibodies are formed against TSH, thyroid stimulating hormone receptor, and stimulate the gland, and that is why the gland growth will increase, and the synthesis of T3 and T4 will increase. So that is why it lead to hyperthyroidism. Okay, so T3, T4 concentration will increase. So the clinical presentation, now what will be the symptoms and other thing? It depends on severity, how much T3, T4 has been increased. Okay, if there is more increase, the severity will be more, isn't it, of thyrotoxicosis. Similarly, duration of disease, how long this hyperthyroidism is there, the patient age and susceptibility to hormone. Okay, and this Graves' disease is more common in female of age group 20 to 40 years. Okay, and the symptoms of the Graves' disease, we will be talking about the other symptoms, but it has a symptoms of hyperthyroidism. Okay, increase. There will be increased sweating. Mostly there will be weight loss. Okay, and anxiety, palpitation, loose stool, heat intolerance, fatigue, warm and moist skin, tremor, tachycardia, menstrual irregularity. You can, all these symptoms you can correlate with the action of the thyroid. It affect the body metabolic rate. Okay, so when there will be more thyroid hormone, the metabolic rate will increase. There will be more heat generation in the body. So always there will be feeling of heat. So that is why the patient cannot tolerate the heat, and there will be warmness, sweating, moist skin, sweating will be there. Okay, and the metabolic action on since the basic metabolic rate is increased, so there will be, okay, burning of all those carbohydrate, fat. So that is why there will be weight loss, anxiety, palpitation. The this thyroid hormone affect the action of adrenaline on the adrenergic receptors. So that is why there will be increased heart rate, palpitation, tachycardia. So just you can correlate all this with the action. Okay. Now, what happens in the test, the blood test, is when you do the thyroid function test, you will find T3 and T4 level is increased and TSS level is decreased. Why TSS decreases? Just there is a phone call repeatedly from MTS. I will just, hello, good morning. No, I class match. Pardon me. हजुर म अहिले क्लासमा छु हस् yes, so T3 T4 level is more, TSS level is less. Is my voice audible to you?
Yes, sir.
Yes, sir.
Yes, sir.
So and thyroglobulin and other antibody are also detected because it is an autoimmune disorder. So that is there. So there will be the thyroid function test will show the increase level of T3, T4, isn't it? Decrease TSS. TSS will decrease because T3 and T4 regulate the release of TSH, isn't it? Okay, negative feedback mechanism. You are since T3, T4 level will increase, so TSH level decreases. So that is the reason. Okay, and of course the antibodies will be detected. Other than that, very typical feature of this grave disease is ophthalmopathy. Okay, so now if you see, there is the eyeball has come little outside and periorbital here, this is thickened, isn't it? Muscles are thickened. So this is a typical X ophthalmopathy is. So this is a typical feature of the Graves' disease. Okay. Apart from other hyperthyroidism conditions. Okay, and this is a scan of the same patient who has this. So the periorbital muscle has been thickened, so that is why the eyeball come little bit outside. Okay, and the eyelid may not close properly, so there will be other ophthalmic problems also. Okay, so similarly, this peritibial mixed edema could also be seen. It is seen in almost like 5% of Graves' disease patients. So there is, you can see, okay, here there is dermopathy. Okay, and this is also a typical feature, that is thyroid acropathy. Okay, here if you see the extremities of the fingers are swollen. There are the clubbing of a nail you can see in this diagram, as well as this portion. Okay, this portion is bigger. Okay, because of swelling and other. So this is again a feature of Graves' disease. Now what do we do is we have lot of options, and the indication in which case we go with these module, and what are the contraindication, advantage and complication. In Graves' disease, you can use antithyroid drugs like carbimazole or propylthiouracil. Okay, and generally it is commonly indicated in first episode in the patient with age less than 40 years, because less than 40 the surgery and then radioiodine is not preferred one. Okay, and contraindication is like pregnancy and breastfeeding, but in low dose propylthiouracil is suitable. We can give. Out of the carbimazole cannot be given. Okay, so that is what we are repeatedly telling. The disadvantages or complication is hypersensitivity rates, agranulocytosis, which is around 0.2%. I have already said agranulocytosis is rare, but it is very important side effect. So you have to be cautious while prescribing. When you prescribe, then you have to warn the patient to report for a sore throat, or you have to do the test. Okay, blood count, total blood count and other. There is more than 50% relapse rate within 2 years after stopping the drug. So that is why that is the disadvantage. And even you can go for surgery also. So surgery, just we are comparing. I am not here to talk about detail of surgery, because that is the surgery thing. Okay, just we are comparing with the medicine. So you can do subtotal thyroidectomy, and it is generally done when there is a large goiter, the size, the growth, the thyroid cells has grown more and there is a goiter. Okay, a large goiter is there, or there is poor drug compliance, the patient is not taking the drug regularly, or the effect is not good. Okay, in that case, and recurrences of thyrotoxic after course of antithyroid drug in young patient. Okay, and now contraindication is previous thyroid surgery, we don't use, and dependence upon the voice. I have already said, like opera singer. Okay, and even a teacher, because there will be the change of the voice, and that is so those, even the actor who are famous for their voice and other, even they are so it is contraindicated in the person who depend on voice. And the drawback is it may cause hypothyroidism, and which is irreversible generally. Transient hypokalemia, because the parathyroid hormone are also there, isn't it? Hormone are also secreted, so that may lead. Permanent hypoparathyroidism may occur in 1% of cases. The radioactive iodine patient, if the patient age is more than 40 years, okay, and recurrence after surgery, the thyrotoxicosis or hyperthyroidism has been seen, in that case it is preferred. And if you cannot do surgery because of the serious comorbid condition, the comorbidity, the other conditions, there is serious comorbidity, then this radioactive iodine is used. And contraindication of radioactive iodine is in pregnancy or planned pregnancy, and within 6 months of treatment. Active grapes ophthalmopathy, in that case it is contraindicated. And disadvantage is it may lead to hypothyroidism, most likely treatment to result in exacerbations of ophthalmopathy. So that is why it is not preferred, okay, with active grapes ophthalmopathy. So this is all about the drugs for hyperthyroidism, or you can say anti-thyroid drugs. Okay. So if you have any doubt, you can ask. Otherwise, we will go for our regular MCQs section. Can I go ahead?
Yes, sir.
Do you have any doubt? Yes or no?
No, sir.
Okay. MCQs. Number 1, conversion of T4 to T3 is not inhibited. Is not inhibited by
D. D. Methimazole.
Okay. Propranolol does, propylthiouracil does, amiodarone also does. Okay. So methimazole doesn't do that. Very good. So option D is correct. Question number 2. The antithyroid drug with the most rapid onset of action. Which have the most rapid onset of action?
B.
Yes.
B.
Okay. B. So why B?
So it contains iodine in potassium iodide. And iodine
Radioactive
inhibits.
iodine, how much time does it take?
So it could peak
2
for
weeks
3
to 3
months.
months.
2 to 3 months. Methimazole,
Of about 3 weeks.
1 to 3 weeks. Propylthiouracil,
1 to 3 weeks.
yes. Lugol's iodine,
It acts immediately and action degrades after 15 days.
it causes thyroid, what?
Escape.
First, constipation. That means none of the thyroid hormone is released. It causes, after 10-15 days, there will be escape of that thyroid hormones. Okay. So Lugol's iodine is the fastest, the rapid acting antithyroid drugs. Okay. Or you can say iodide compound. Okay. So that is. Now question number 3. Beta blocker are useful in hyperthyroidism. Okay, which one is correct answer?
A.
A.
Any other answer? No answer, only A. Yes, A is the correct answer. It is used for symptomatic therapy till the effect of carbimazole develops. Okay, so to develop the effect carbimazole, it requires few weeks. So to give symptomatic relief, we use beta blocker. And among beta blocker, which one is preferred? Yes, very good. Which question number 4? Which of the following medicine is not included in management of thyrotoxic crisis? Crisis means it is a severe emergency condition. In emergency, which drug is not? Yes.
C.
Radioactive iodine.
Yes, correct. C is the correct answer. Propylthiouracil is preferred. It has antithyroid action. Propranolol gives symptomatic relief. Corticosteroids, hydrocortisone is also required for other symptomatic management. Radioactive iodine, since it takes few months, we cannot wait in case of crisis. Okay. So this is all about the MCQs, and the last I will leave the class with this question, SAQ. Okay, why propylthiouracil is preferred in pregnant and lactating mother, especially pregnancy of first trimester. Okay, we prefer propylthiouracil, but not in other cases of hyperthyroidism. In other case, we don't prefer propylthiouracil. What is the reason and why we prefer it in pregnant and lactating mother? Okay. I hope the answer we have already discussed in the class, isn't it?
Yes, sir.
Okay, so please do that as an assignment, and when you come to Deep, you have to submit. Okay?
Yes, sir.
Okay, so this is all about today's class. If you have any doubt or questions, you can ask. No questions?